Well, I have to tell you that a $426 million cut to hospitals could create some very serious operations problems in many hospitals, especially if it's done with regard to an across-the-board cut, which is what the governor's budget proposal was, to cut hospitals some 6% across the board. I have hospitals who simply would not be able to continue their operations if those cuts went into effect.
You're talking about closing hospitals?
Absolutely. There are hospitals who have said to their legislators that if they had to suffer this level of cuts, that they would not be able to continue their operations. So communities would lose the availability to high quality and accessible care, but they'd also lose those jobs. So it could have a major adverse impact on the economy of those communities as well. Remember that in many communities, hospitals are the largest employer.
Sir, let's talk about some of the alternatives that IHA is offering the lawmakers, and you talked about delaying payments. Let's briefly go over that.
The Illinois Hospital Association has offered several what we think are very good alternative ways of reducing the expense of the Medicaid program without doing blunt cuts across the board. One of them, for example, is a strategy to reduce the number of people who, when they leave the hospital, are readmitted within 15 days. We believe we've come up with a policy strategy that would save the state at least $40 million in the first year by implementing a readmissions policy. And yes, we did talk about the fact that the state could extend the payment cycle rather than do cuts across the board. Hospitals certainly deserve to and would rather be paid timely payments, but better to be paid late than take an inadequate payment, because the Medicaid program is already paying less than the cost to deliver Medicaid care. So rather than take an inadequate payment and make it even more inadequate by cuts, we did say to the committee that extending the payment cycle was a more viable approach.
You could say that, sir, that, I mean, most of the state has usually been late with its payment to begin with, so we could kind of say that service providers are used to it. Would you say that, the whole delayed payments right now? Like currently, about how long is the state late with their payments?
It is true that the state, has a history, if not a tradition, of being an untimely payer. With regard to services to hospitals, for services provided to state employees and retirees, we have hospitals who haven't been paid in over 250 days for services that were provided that long ago. On Medicaid payments, for the last year, the state has been much more timely because of a federal requirement that hospitals, should be paid in a timely fashion. So they've been much better in the last year and a half under the federal stimulus law, which goes away in July. So the point is that it's not a new notion that the state would pay slower. So when we say we would agree to extending the payment cycle, that's been what's more normal than a prompt payment approach.
Mr. Peters, is there anything else you'd like to add that you'd like our readers to know regarding these proposed cuts?
No, I think what's important is that hospitals are the cornerstone for health care for communities all across the state of Illinois. And we have given the state some good alternatives to cuts. Through the hospital assessment program, we bring in hundreds of millions of dollars a year to the state. And so we certainly think we are worthy of the state's continued support in not doing cuts across the board for hospitals, because to do so not only threatens the availability of care, it also threatens the local economy, because as I've indicated, hospitals provide about 250,000 jobs a year across the state.